been doing after these performances is hearing from folks who are working in healthcare and in housing justice and basically in these systems that we just learned about. Even though, you saw in some of the performance that these systems could use some transformation, there's a lot of stuff that is really good that we want to celebrate that's happening in those systems as well. And there are a lot of people who are doing good work that we want to celebrate and hear from. So would you like to introduce yourself, who I have with me tonight? Yeah.
Absolutely. Hello, everyone. My name is Dr. Femi Akinnagbe. I am a primary care physician in San Pedro, California. I work at a federally qualified health center, which means that the over 85% of our patient population is either Medi-Cal, unhoused, formerly incarcerated, and in various states of underserved. And I am very much both excited and committed to the work of utilizing healthcare as a tool of empowerment to help people really not only maneuver out of some of the challenges that some of our very uncompassionate systems impose upon them, but also to find ways to help people live their best life despite whatever challenges are in front of them.
Yeah, thank you. So I'm hoping first maybe you can say a little bit about how you got into this line of work.
Yeah, I think how I got into medicine is slightly different from how I became very interested and invested in the work of medicine as a tool of empowerment. And how I got into medicine was somewhat straightforward. I was before my senior year of college, I was on a medical missions trip overseas, and I was assisting in both teaching AIDS, HIV prevention in the community, as well as documenting the work of the primary care staff and the surgeons. And I took part in some deliveries and some childbirths, and I was like, this is amazing.
Yeah.
And it was, and that's what got me very excited about medicine. Recognizing the power of medicine to change people's lives, that really came from a very early age. I was born and raised out in the greater Washington, D.C. area, the child of 2 West African immigrants, and growing up, our neighborhoods were full of all types of the challenges that we see now that these uncompassionate systems place upon us. There are plenty of times that at different times during my childhood, my family was homeless, living in shelters. There were times when I was actually taken from my family and was in foster care and in group homes, and just different challenges like that. Eventually I was able to get back with my family, but through it all, a couple of things were very, very powerful and very profound that really shaped me. And the importance of having a stable place to live, like that can't be understated, right? So many things in our world, like I think we all can, or many of us can appreciate the ability to take ourselves out of or away from some of the craziness and challenges in life, and have just even a small space that we call our own, that we can rest our head, and the safety that brings. And then that safety and stability then can become a jumping off point that allows us to move into other aspects of our lives and experience more of our humanity. But without that, then we often find ourselves in this very contracted state, really, Maslow's hierarchy of needs, just trying to survive. And so a lot of things that people see when they say, oh, these people over here on Skid Row, wherever, they're crazy, they're not making sense. Well, I don't know how open-minded and equanimous you would be if you didn't have a place to rest your head at that was safe. So that I think that's kind of that's the short story.
Yeah. That's a good story. I'm hoping too, because I know that the connection with Claremont is we asked through Uncommon Good about folks who would want to speak at Claremont specifically. So I'm wondering, and I know that there are people in the audience who are connected to Uncommon Good as well. Would you tell us a little bit about that program?
Yeah, so Uncommon Good is a nonprofit that does a lot of amazing work in the Greater LA area. Some different programs, some mentoring programs and pipeline programs to get students from from communities that are underrepresented in medicine to take part in mentorship and getting them in line along medical tracks early on. The reason is something like medicine it's those who have had a parent, family member, or someone before them walk that track, it's much easier to understand what needs to be done with it. Yeah. However, when that isn't the case, then there are a number of barriers that an individual trying to navigate through just doesn't know how to navigate through. So pipeline programs are one of the main programs that Uncommon Good takes part in. Yeah.
Great. Yeah. Thank you. Yeah, and that is based out of Claremont, I believe. Yeah. And something that I think I'm going to talk for a second just to give you. Please. I realize that with one panelist, it's you don't get a break, right? It's like one question after another. So something that I have really learned in this COVID hotel project is that it's not just the place; it's also the people who are in the place, right? Something that I've seen in all of the interviews that we did with the frontline workers for the COVID hotel is that these were really people who wanted to help and people who were intensely passionate about making a difference and sometimes making a difference in a way that was not really aligned with the system that was already in place, right? So they changed it around. And I think it's great that, you're speaking to a program that helps people get into that work because I think that it's often really hard, as you say, to get into something like medicine where there are a lot of barriers along the way for that and there's a lot of gatekeeping that happens. Sure. Yeah. I
totally agree. And I think also, that when we talk about flexibility, I think that's really important because as the performance highlighted, the systems the bigger they are, often the clunkier and less efficient they are. And they're all because of the internal and external reporting needs and yada yada yada. All these guidelines that oftentimes take away from the actual delivered services of the system. And oftentimes the most effective individuals in a system are often most effective when they're not working within the system, when they're working outside of the system. And it takes a certain degree of flexibility to see what the need is and let me feel that. And it doesn't have to be something crazy, or sometimes it's as simple as being present with the person and helping them to get to the next place they need to be in their care or whatever it is they need for themselves. But I think that if we take that perspective, that it's not just because this person has this title of outreach worker and this person has this title of whatever, that it's these other people's responsibility to help make this change. But if we take the perspective that we all can help make the change in this way to build more compassionate communities that are of service to individuals wherever there's a need, then and we respond with that level of flexibility, then I think overall all of us as a community, the Greater Los Angeles starts to improve, and we start to really address these insidious issues.
Make the system work for and with us rather than working with the system that we have, basically.
And we can also burn it all down.
We can do both at the same time, right?
Sometimes when I look at the system, I get so frustrated at it. I'm like, why is this like this? It's almost like the system is some aspects of the system are designed to be defunct and not work. But that's a different.
I'm gonna open it up to the audience for questions. Please.
Dr. Femi, I just would like to thank you with all my heart for your incredible, compassionate, very important work on the front lines of healthcare for people who need you the most. And I just so appreciate you. And correct me if I'm wrong, but I think I understand that you've also tried to incorporate holistic medicine or alternative forms of medicine in with the sort of standard protocols of care in your clinic. And if that's true, could you tell us a little bit more about that? Thank you.
Thank you. So yes, holistic medicine, integrated medicine, complementary alternative medicine, very near and dear to my heart. It is something that I have, again, both my parents being from West Africa, it is something that was done in our household right alongside allopathic Western medicine. And so I didn't grow up thinking it was, a different thing, until like I, would start talking to friends about like home, how to fix certain things. And a friend of mine would be like, oh, you go to get some cough syrup. And I'd be like, why don't we just put garlic on the bottom of our feet and go to sleep? Like, true story, I did that to my daughter last night. I cleaned all of her nasal out. Yeah, FYI. Yeah, all right? And then, so before medical school, I did a grad program in physiology, biophysics, and complementary and alternative medicine. And that really helped to codify and broaden my understanding of how different healing practices from across the world can be integrated into our Western medical system. And now, because of some of the parameters and where I work, and actually for a federally qualified health center, I will say I'm very fortunate because I have great leadership that's like, you want to do it? Go for it. Mm-hmm. So, whether it's teaching meditation or yoga to my patients, or helping to, I'm a big fan of diet. Like, food is medicine, and so I really like to preach on the importance of that. And this also comes back to what we were talking about before, in how food is such an essential part of our health and well-being. However, not having the stability of housing to keep your food safe, cold food cold, warm food warm, that puts you at an inherent disadvantage when it comes to the ability to have a healthy, safe life. So you see all these issues are very much integrated themselves, and I think that if we're gonna solve this problem as a whole, then it does take many people coming from many perspectives and many hands making work light to lift this load and solve this problem.
Yeah. I have a question.
Man.
Can y'all put a medication together, liquid form, to help people that have arthur and bursitis and all that? Because I've been thinking that for many years. I would like to go into the lab and mix a liquid, because all these pills of Tylenol, Aleve, they're great, but we need a liquid formula where all of the senior citizens and elderly, where we can go out for 24 hours and we don't have to constantly feel the pain.
Yeah, I'm working on it now. No. Something you bring up with this is, and I'm talking about this with my mother-in-law now, how different systems of medicine are beneficial for different things, more beneficial for different things. We think that I'm an MD, a medical doctor. We think that our system of allopathic MD medicine is the best at everything. And it isn't. It's the best at some things. It's very good at other things. And it's totally terrible at other things. Okay? I always say that there is no place, heaven forbid, a person would rather get into a car accident or a major trauma than a major American city, because we have the best acute traumatic care anywhere in the world.
Right.
However, America, in many regards, is one of the worst places in the world to age.
Yes.
We don't. Hallelujah.
understand.
we don't have a great grasp on how to manage effectively the very natural biological process of aging. We pathologize it, everything's a problem. And then on top of that, the way our medicines and medical system works is that instead of trying to treat the whole person and identify what is driving some of the deeper pathology, we say, here's a symptom, here's this pill. Here's a symptom, here's this treatment. Right. So, all I say, again, going back to my mother-in-law, is that for some of her concerns and things like arthritis, bursitis, those are inflammatory conditions, so this also holds true. Traditional Chinese medicine, TCM, traditional Chinese medicine, very good at this. So you find an acupuncturist who is also, because oftentimes acupuncturists, traditional Chinese medicine practitioners practice herbs, acupuncture, or both. So you find it's easier to find an acupuncturist if you look one up. Find an acupuncturist who practices herbs as well, and then you'd be able to get the best of both worlds.
Great. All right, I'll go for that. Show me one, I'll go there.
So what's been getting a huge amount of attention recently is the city-county agency that for decades has dealt with the homeless population called LAHSA, Los Angeles Health Services Authority. It's collapsing. The county has officially withdrawn its money. It's going to create its own agency. The city has to decide whether they're pulling out of LAHSA and creating another agency, or they're trying to recreate LAHSA in some city-based form. So these are massive systems that are, for better or worse, in the process of changing. Because of your work with patients, but also patients within systems, when you see massive systemic change on the horizon that's going to directly affect how services are delivered to folks who are homeless or possibly on the verge of homelessness, what do you see as a positive outcome of what's going on right now, and what do you see as a negative possible outcome?
I'll answer that question. Before I do, I want to hear how you feel about LAHSA.
I'll tell you, I'm a little concerned that a lot is happening very quickly, but I'll tell you what I think about LAHSA is LAHSA ended up doing the exact opposite of what it was created to do. It was created to be a bridge between the city and the county, because the city and the county, whether it's homeless services or anything else, do not work well together. So people understood that, and so they created LAHSA to be the bridge for homelessness services, getting the city and the county to work well together. But instead it became its own bureaucracy that, instead of bridging the city and the county, just became one more lack of transparency and accountability, which actually hurt the city and actually hurt the county. But that doesn't answer the question, now what do you do that's better?
Yeah. To answer that question, I think that the first thing that was coming up to me when you were talking was new wine, old wineskins. And the metaphor with that is not the only way, when there's a change like this, if there isn't deep systemic introspection as to why LAHSA became the bureaucratic nightmare it became, and why it became inefficient in ways that it became inefficient, then I think that what potentially will happen as funding gets pulled and goes to other places, those people and those systems will follow that funding, and that same inefficiency will get reproduced elsewhere. But if there's a true look at what went wrong and why things went wrong, then I think that won't be the case. And without without offending too many people, I do think there's an issue when the compensation packages of C-suite individuals in organizations like LASA are on par or above equally matched individuals in the private sector. And this is like kind of tangential to the service, the direct service that's being provided. But for me, what that does is that it sends a message that resources are moving up through the system instead of down through the system. And so that's one of the issues. I just want to check to make sure my boss hasn't called to fire me for anything. Okay,
You're in a friendly audience.
All right, good. You still do have to deal with these people. So that was there another question?
Well, what do you see as the best potential positive as opposed to what you see as the best or the worst potential negative?
Of changing the system.
Of this thing going to a massive reorganization.
Yeah, I think that a positive will be that new ideas, new changes, but also actually decentralization of services will be beneficial, because one of the problems with a big system is that it can try to prescribe the same remedy for multiple different situations and issues, and that can often not be appropriate. Sometimes it's appropriate, and that's not speaking at all to intention. It's trying to do good work, but like it's just some people, not everybody needs the exact same thing. So you can tailor services more when there are when there's a decentralized model of how care and services are provided. A downside of that would be kind of the same thing in that there is a greater level of subjectivity in how care and services are provided. And so if you're at a service center where the people aren't burned out and they're well compensated and they're actually like being able to help provide good service to the people, and then people around in the community, then you can see that community really thriving, flourishing, and helping people to find housing, and it's great. However, if you're in a system where that isn't the case, or a service center where that isn't the case, and maybe because of community issues or internal issues to that service center, then it can be a huge money pit that is not doing what it was designed to do.
Earlier I just wanted to say that I feel like there's been more community acupuncture clinics popping up in LA. My friend Jenny Garcia, who follow her on Instagram, has been doing that a lot. And then also I just want to be mindful of time, that probably we should wrap this portion with Dr. Sarah and Dr. Femi up, and unless there's a closing, yeah.
Well, I'm just really curious, because I don't know exactly, because we've been trying to reach people in Claremont. Where are the homeless people? I found them at the library and somewhere here. But it was very difficult to connect with people and to find where are the services, what is going on, where are people actually in the street helping people. So I just wanted to hear what is happening right here.
That would be a great question for someone that's not me.
I'll invoke the name of our second panelist, Rachel Forrester, who is actually a housing activist in Claremont. I'll send our healing energy to her, and then also I'll just share her name so that if anyone is interested in connecting with her, Forrester, like the car. Yeah. Rachel.
So I'm Rachel's mother.
Oh!
Rachel has vertigo tonight. So
yeah, that's what she said. Yeah.
There are services in Claremont. There are homeless people in Claremont.
Yeah, I've seen them. Yeah.
I personally can't address all those issues. I know that there are good people that watch out for homeless people in Claremont and take care of them.
That's good.
I know that doesn't solve every problem. They have a food pantry that opens up once a month on a Monday, and people are able to bring food. They used to have a cabinet at the church, and I don't know what happened to that. That didn't exist anymore, doesn't exist anymore. But you talked about safe landing sites,
Yeah.
and I thought, what a need
Yeah.
there is for that here. And how do you do that? How do you get one of those? What's the process for that?
Yeah? You want to answer that? Because that is what Claremont needs to know.
What is the process for that? I don't know if I'm really the best person to answer that.
Yeah, Jen, you want to
So the safe landings have been initiated by Housing for Health,
Yeah.
which is the part of the LA County Department of Health Services that provides health care for homeless people. And so they've those are low barrier places you can just walk into, as Marvin did, in the show, without a referral, and if you can get in one place to stay, if you can get a lazy boy chair, or there's a huge one that Henriette and I visited recently on Imperial Highway. It's 5 buildings, a dormitory for women, a dormitory for men, a dormitory for families, a community space, and then an administrative building with grounds and everything. And people can stay there. You can walk in off the street, you can get medical care, you can get a bed. You can stay there for 6 months, a year, until you get permanent housing. And so Housing for Health has initiated these 2 things, and they're doing a big, huge campus like that in Skid Row that's going to open in the next month or 2. And so they are actually, with regard to LASA, the county said that there was a RAND report that came out about the Housing for Health approach prior to the pandemic even, they were really pioneering some of these ways of creating health centers. And they said the county is going to throw their money into that model, into replicating that model. And the performances, that's why we're doing our foolish, mad world tour of LA County and going to every neighborhood and saying, yeah, there should be one here, there should be one there, there should be one there, there should be one there. Because I think Femi sort of said this earlier, and we said it in the show, really, these systems, some of them, they just drain the energy out of people because they're so impossible to deal with, but if there's actually, something that's accessible, then I think, that it really will, motivate the people that are of goodwill and generate people of goodwill and de-accelerate cynicism at the same time. So.
And what I'll add to that is I think that this is a conversation that's happening in a lot of neighborhoods in Los Angeles right now. So for instance, we're taking this performance to Van Nuys next month, and the people who we're in conversation with there are really interested in creating a center that's accessible in Van Nuys. And so I think it's sort of like what you were saying about, everything can be more decentralized and more specific, but also we kind of need that overarching system. I think we need people to talk to each other across these neighborhoods and to exchange these ideas and these ways of organizing and these ways of building. And then we also need to take it back to the neighborhoods that we're in.
It is difficult in Claremont because, while there's lots of really good people trying to solve these problems, there's a whole lot of other people who don't want that in their neighborhood.
Exactly.
Yeah.
And it's really unfortunate.
A lot of places are split 50-50 on whether they want to help the homeless or they don't.
Yeah.
Churches right down the middle, some of them,
Yeah.
here in Claremont. But there's, I think your play, what you're doing here is very good because it gets subtle messages across in a way that people can understand them. And that's one of the hardest things. I mean, what she was saying is that, there are a lot of people who wanted to help, but they didn't know how. They couldn't figure out how. Well, that's certainly true.
Yeah.
The homeless people do not, you know, like people say, they don't want help. Yes, they do,
Yes.
but they don't want the hassle.
Yeah.
And some programs come up and all they become, because of how people can react, they become hassles. Money certainly is an effect on some people. Some people know how to handle it, some people don't. Education is a very important thing as well. And what you said before, that the house, a place to put your stuff and a place to lay your head
Yeah.
is extremely important and cannot be overstated.
Yeah.
Because that is really, I mean, just listen to George Carlin's routine about your stuff, you know. Well, that happens very much every day.
Yep.
That compassion, compassion, and compassion. And when you run out of that, go get some more.
We appreciate all of your wisdom that you brought here today and your experience. And thank you, everyone, for